Steve Westman is sitting in for Aaron. Aaron will be here a little later in the show.
She better be.
You're handling this well.
I'm trying.
All right. I want to welcome to the big round table Dr. Jennifer Gillette.
Hello.
Hello.
Dr. Gillette is with the UNM Cancer Center. Your title is UNM Assistant Professor of Pathology there. And,
Yes.
And hey, thanks for getting up early to join us here on the program.
Thanks so much for having me. It's a pleasure.
Now, you won a grant.
I did.
Yeah, this is a big thing, and we'll talk about that. Give us a little of your background, first of all.
So my background, I got my PhD in cell biology at the University of Colorado, and then from there I did my postdoctoral training at the National Institutes of Health in Bethesda, Maryland, outside of Washington, D.C., and since then I've been here at UNM for about 2.5 years working in the Cancer Center.
Nice.
Yeah.
A lot of people don't realize that research, you don't have to just be an MD to do that. There's a whole lot of you at the PhD level that are doing this kind of work as well.
Absolutely. Absolutely. A lot of us, actually.
Yeah. And what attracted you to the UNM Cancer Center? Was it a crazy job offer that you liked, or what?
Actually, a lot of things. I think people are always surprised when they come to New Mexico. The amount of the research and the caliber of work that's going on here is really eye-opening. And so when I got here, I was so pleasantly surprised, not only with the caliber of the research, but also the people, which really
Being a part of a great team.
Yes, it's
really
a fabulous
means
team
a
at the
lot.
Cancer Center. Yes.
Okay, this grant you're working on now, you got it as of January of this year.
Yes, that's correct.
And this is a grant, a $300,000 grant for blood cell research. I kind of pride myself on pronouncing all the words, but this one threw me. You're focusing on what kind of stem cells?
They're called hematopoietic stem cells. And so hematopoietic stem cells are the stem cells, they're adult stem cells in all of our bodies, and they're responsible for giving rise to all of the blood and immune cells. So if you cut your finger or if you donate blood, your body replenishes the blood, right? And those come from the hematopoietic stem cells.
I see.
Yeah.
Okay.
Now the focus of the grant is what?
The focus of the grant is on using those hematopoietic stem cells to help sort of repair scar tissue in the heart following heart attack.
Okay, and in reading the details on this research, it's interesting. You're saying the cells go to the place where there's been an invasion or a wound or something like that, and describe how that works in the body.
Yes, no, absolutely. So these are stem cells that reside predominantly in the bone marrow. So they're in your bones, but they're always surveying the situation. They're always being released out into the blood and checking things out if there's an infection or if there's something going on.
They're always on patrol.
Absolutely.
Okay.
And that's a good thing.
Yeah.
And then it's interesting, what we've realized in the last few years is that when someone's undergoing a heart attack, these are cells that get mobilized or released into the blood and will home or traffic right to the heart. And what they do there is really one of the questions that we don't understand. And so that's sort of part of our research, is figuring out how the cells get targeted to the heart and what kind of signaling they're doing to try to repair the heart.
So you know they're being called to the heart to do something, and we just don't know what yet is what.
Kind of.
Yeah.
Yes.
Okay.
Yes.
Is there a theory and what you think is going on?
Yes, of course, always theories. We're scientists, right? That's what we do. Yes, so what we think is happening is the stem cells are getting targeted and recruited to the heart, and what they're doing is they're signaling to that damaged environment. And by signaling, they give off signals to try to repair that environment, to bring in new vasculature. Obviously, during heart attack, there's a scarring that occurs that blocks the blood flow. And so what we need to do is bring the blood flow back to the heart. And it's thought that these are cells that are going there to try to signal to that damaged area to try to repair it.
In a way, they're kind of the first responders in your body.
Absolutely are.
That's interesting.
Is there part of the body that adheres those cells, certain bodies, that adheres those cells from going there to try to repair?
That sort of prevents that?
Right.
That's a great question. I don't think we know much about how that could be prevented, but the nice thing is these are also cells that are used traditionally in stem cell transplants for example, leukemia patients. So these are cells that we can, anyone can be a donator of these stem cells, and we can put them back into patients, for example, who've gone through severe chemotherapy.
This is remarkable.
And they will home back to the bone marrow and replenish the cells, which is pretty, remarkable, as you said.
Does this just occur in a heart attack scenario, or is some other injury to the body or some other organ distress do the same thing?
Right now, the heart attack is one of those main things. Stroke in the brain is something that's coming out now that we're looking further into. It's thought that they may also be involved in that, some kind of hypoxic or lack of oxygen type of event. These cells could be recruited to that as well.
Can you actually count these cells in the microscope and see them? Or?
Absolutely. Absolutely. You should come by. You can take a look.
No kidding. Now, how do you simulate this in the lab? How do you do that?
So a lot of different ways. Obviously, these are cells that we can take out and we can put in culture, and as you said, look at them under a microscope. A lot of times for these types of experiments where you're trying to see if they will home or migrate to a wounded site, most of that's done in vivo in mice. So we can, tail vein inject them back into mice, and in less than 16 hours, they will have, found their home in the bone marrow again and setting up shop. They're pretty remarkable
fascinating.
cells. They're really remarkable.
Now I'm wishing the biology class in school was this interesting. Man, this would have been great.
Because it is that interesting.
But you can physically see the cells migrate.
Yes, yes.
How do they? You said they're in the bone marrow. Do they just pop out, or I mean?
Yeah, kind of. You can think of
really?
it that way. So they have to. We call it extravasate, or so they have to leave the blood. So they go through obviously all of your the veins, and they'll have to cross through the endothelium and in and out of the endothelium. So they can do that. They cross through and come back out, and yeah.
Now, do the white blood cells, because they're there to prevent too many red blood cells from happening. What are they doing while all this is going on in your body?
Well, I mean, predominantly those are responsible for more things like infection and things like that. Right. So it just depends. But these hematopoietic stem cells also are the ones that are upstream that give rise to the white blood cells as well.
I see.
So these are they're the starting ground.
Okay.
Which is quite handy to have.
With the grant, as you work on this, they gave you this, and you're going to present an outcome of some kind, right? Based on
Hopefully.
the research. Yeah. How long do you have to complete your work on this?
So it's a 4-year grant, and as you said, it started in January. So we have a few years to get things going, which is good, because it definitely takes some time, but we're well underway.
How long did it take you to prepare the grant?
The grant took me about 1.5 years.
It's not an easy process.
No,
Yeah.
it's a very long, arduous process actually, because you have to submit and get feedback and then resubmit, and yeah.
I love the sense of discovery here. Like you said, you have a theory on what is going on here. What will this kind of research lead to, in your opinion?
Well, what our hopes are, the goal, I guess, is that these are cells that can then be used, hopefully, in targeted therapies. Like I said, they're already being used in the clinic for leukemias, and we're trying to, anything that we find can be applied to that, but our hope is that they could be used potentially, in a patient with heart attack, something like that happens, if they could be injected in and help repair the sites, which would
You
be
mean
fantastic.
if a heart attack is occurring, then physicians can...
Once you get to it would be one of those treatments that could
Wow.
occur. Yeah.
That would be part of saving your life.
That's huge.
Yeah, potentially. Yeah, that's our hope.
That's
But like
really
I said, these are
fascinating.
also cells. Anything that we learn about how the cells home and migrate to the heart is also incredibly important for how they home and get back to the bone marrow or these other sites, because if they don't efficiently get to the bone marrow, they're not efficiently transplanted in
They
a leukemia
go back
patient.
to the bone marrow. Wow.
So they're constantly circulating and can come in and out. And how that happens, we we know some things, but not a lot, which is pretty impressive.
Yeah. What can we do to encourage them to do what they do?
Exactly.
Yeah.
Exactly. That would be a wonderful thing.
Yeah, we don't know what makes them come out, but it's just that trauma. That's fascinating. That really is fascinating. What other kind of work do you do? This isn't the only thing that you're involved in over there.
So we're very much interested in how the main sort of idea is how these hematopoietic stem cells receive signals from their different microenvironments, and how those signals that they get or give to the microenvironment regulate their function. For example, how do these cells turn into a blood cell versus a white blood cell, and those kinds of things, and what does it get from the microenvironment or the bone marrow versus the heart or something like that allows it to do that.
Absolutely fascinating. Well, very good. Any other questions there,
No,
Steve?
this was an education I wasn't expecting to get today, and it was, wow, thank you.
All part of the work that goes on at the UNM Cancer
Yes.
Center, and people can go to the website and find out more. every time we talk to somebody from the UNM Cancer Center, it's just eye-opening, wonderful work. And
Thank you.
I'm glad to know you're there and doing what you do.
There are lots of us there doing great work. So yes, please check out the website.
Yeah,
Thank
congratulations on this grant.
Yeah.
And,
All right, thank you.
I hope
Thank
it's
you.
a successful bit of research for you, and thanks for your good work.
Thank you.